Hello, good afternoon. My name is Anak Agung Lhiannza Mahendra Putri and my study number is 026. So today I'm going to do a presentation in the topic of aortic valve stenosis. So there will be 6 subtopics that I will explain in this presentation. The first one is about the definition. So aortic valve stenosis is a progressive fibrocalcification, remodeling, and the thickening of aortic valve cuffs, which will get worse after a couple of years until severely obstruct the cardiac blood flow. So this AVS is the most common cause of valvular heart disease based on its high mortality and morbidity. So the prevalence in developed countries, there are 25% in the age of above 65 years old and about 50% in the population of above 85 years old. So about the pathophysiology, there is a linkage between coronary flow with AVS condition. So in AVS condition, there will be limited space left for circulation. That will decrease blood flow with enormous pressure in the left ventricle. So that will cause a changement in pathophysiological and morphological compensatory process in the left ventricle, and there will be fibrosis and hypertrophy. And that condition will extend oxygen demand that will suppress in the balance of ventricular arterial system, including microcirculation and epicardial coronary artery blood flow. So there are stages in this AVS condition. The first one is mild, moderate, and severe. And about the mild and moderate AVS, the patient might have no symptoms but have mild to moderate tricuspid or bicuspid calcification with some systolic motion devaluation. And the severe AVS, there are asymptomatic severe AVS and symptomatic severe AVS. Moreover, about the severe AVS, in symptomatic and asymptomatic severe AVS, the patient might have severe calcification or congenital stenosis followed by severe decreased cups opening. But in asymptomatic severe AVS patients, they might have no symptoms, and the symptomatic severe AVS, the patient might have dyspnea, angina, syncope or pre-syncope, decreased on exercise endurance, even heart failure. And how to diagnose this condition in a patient? So we can have the information about this AVS condition by doing a physical examination, especially auscultation. The typical sound in this AVS condition is crescendo-decrescendo systolic ejection murmur spread to the neck, and when this condition started to get worse, there will be no murmur heard, crest progressively in systolic and thrill. And when the condition on a patient have worsened stenosis, the murmur will lastly heard because of the reduced stroke volume. So the other way to diagnose this AVS condition is by doing an echocardiography. So this echocardiography has a great accuracy and consistency. So the treatment in these AVS patients, actually there are no medication that can debilitate nor reverse the condition into the preferable ones. And the surgical treatment, there is an option in transcatheteric aortic valve implantation or TAVI. This TAVI is a worthwhile alternative compared to surgical aortic valve replacement for patients with symptomatic severe AVS. When is the right time to do this? The right time to do this is when the limited and permanent risk of the intervention procedure exceeded by the risk of not doing the intervention. So these are the references that I use in this topic. So that's all about my presentation. Thank you for your kind attention. Good afternoon and have a nice day.